Hi, and welcome to the Family Development Center. My name is Claudia Nguyen. I am the Health Services Director. During this training, you will receive an orientation in regards to health services. My area involves health, safety, and nutrition. Here's a little bit about myself. I started working at the FDC as the Health Services Director on August 2014. Prior to working at the FDC, I worked as a health manager for two other Head Start agencies, Catholic Charities in Joliet and LifeLink, providing services to DuPage families. I have two children, Hunter, who is 6 years old and in first grade, and Riker, who is a year old. My husband, Ben, is a police officer, and we all live in Homer Glen. I am originally from Wheeling, Illinois. My parents are both Mexican, and I speak Spanish fluently. I enjoy working at the FDC, and please know that my door is always open. So let me know if there's anything I can do to help you. My biggest thing is that I believe that working as a team is the most successful way we will be able to get things done. Here are a couple pictures to share. First picture is a picture of me and my family. The other picture is a picture of me and my team, Mr. Paul and Miss Mary. And the third picture is of me and the administrative team. During the orientation, we will focus on certain topics. We will discuss a few items related to your onboarding sessions, but also discuss things that you will learn about while you are shadowing teachers in the classrooms. We will discuss certain forms, certain procedures. We will also talk about the prenatal program. You may have already received a training packet, which includes a few links to trainings in regards to working with children. If you haven't, soon you will receive the 3 trainings that are required for health services. The first being the bloodborne pathogens, the second, managing infectious disease, bug busting in early childcare, and the third, the coronavirus prevention training. Also part of your onboarding process is your DCFS medical exam, which also has a TB screening. It is important that you know that we require an annual DCFS medical exam. So note on your phone or on your calendar when you will be due this time next year for a new updated physical. Your TB is under the discretion of your doctor from here on out. We only require your initial TB screening test. Another part of the medical exam is now the immunizations requirements. In 2015, DCFS requires that we all have a Tdap booster within the last 7 years and show proof of 2 measles, mumps, and rubella vaccines, or complete a blood test titer to determine immunity. Not necessarily required, but we do like to inquire about the hepatitis B vaccine. If you believe you have not received the 3 series vaccine, please be sure to contact me if you're interested in receiving the 3 series hepatitis B vaccine. I will link you up with human resources. It is very important to understand the reasons why we do certain things a certain way at the FDC. As you may already know, we have different funding sources. We have an early Head Start grant. We also are DCFS licensed. We have a Preschool for All grant governed by Illinois State Board of Education, and we are also NACCE accredited. At enrollment, children also are required to provide health documents. Each child enrolled in center-based cannot enter our program without a physical, a record of immunizations, and possible dental. Home-based visitors also work with families in order to retrieve these documents. The purpose of it is to determine that the children are up to date according to the EPSDT schedule, which is set forth by the American Academy of Pediatrics. Family support specialists and enrollment obtain the documentation. They do have me review, again, to go over and ensure that children are up to date or help children become up to date with preventative health care. Once reviewed, the family support specialist enter the information to our data entry system and file in each child's file. We then follow up with parents, in particular infants and toddlers, to ensure that they're going to their well baby visits. And visits do happen periodically and often at 2 months, 4 months, 6 months, 9 months, 12 months, 15 months, 24 months, and so on. Parents are really good with providing us the documentation once they've received those reminders. So we do work as a team to remind parents in order to achieve proper preventative care. Here is a link to a website that I constantly visit in order to assist me in my area. eClick, which is the Early Childhood Learning and Knowledge Center set forth by Head Start. It has a plethora of resources, not just primarily focused on health services, but also developmental, mental health, family services, emergency preparedness. If you're curious to learn more about your field in ECE and ways to help and encourage children's development, in ways to address certain concerns, eClick is a great resource. In addition to health requirements, we also provide sensory screenings. This is something you may be familiar with because oftentimes developmental screenings get completed by classroom teachers. Infants and toddler teachers do also complete sensory screenings, which are the vision and hearing screenings. We use a functional observation tool to complete the screenings for children. It is important to note that these are screenings and not tests. If there are any concerns or failed screenings, we refer the family to their primary caregiver for further evaluation. Preschool children get screened in collaboration with Governor State University's Nursing Department and the Communication Disorder Department. In oral health at the FDC, we support the children by having them brush their teeth on a daily basis. Classroom determine the best time for this. It is important that we support oral health in the classroom. Toothbrushes are provided as well as toothpaste and toothbrushing cups. A program must promote effective oral health hygiene by ensuring all children with teeth are assisted by appropriate staff or volunteers. Infants, toddlers, and preschool-age children do brush their teeth once a day. Children who are 2 and older are then required to provide a dental exam. The dental exam must be completed by a dentist on the Illinois dental exam form. If any child is determined to need treatment, we must follow up with the family so that proper treatment is provided. Another part of the requirements, in particular for infants and toddlers, is completing the My Day at Home. This is a very vital instrument that we use to determine and provide information to the parent regarding the infant or toddler. At drop-off, parents are required to share the necessary information that we may need in order to provide the services that the child and to meet the child's needs for the day. For example, did the child sleep well? Is this child not feeling well? Did the child receive any medication? Throughout the day, teachers are noting the child's eating schedule, napping schedule, and the use of the bathroom. Teachers also use this as a way to remind parents of things they may need to bring to the classroom the very next day. For example, a change of extra clothes. As previously noted, you may have received a packet filled with links for trainings. One of your links is in regards to safe sleep. It is important that as an adult in the classroom, children are observed sleeping in a crib or a cot. Infants under the age of 15 months must sleep in a crib with a tight-fitted mattress sheet and nothing else in the crib. No blankets are allowed in the crib. Children 15 months and older are then transitioned into a cot. These cots are provided by the center in addition to cot sheets. Cot sheets, crib sheets are also laundered twice per week. Cots are cleaned and disinfected twice per week. It's important to note that cribs and cots must be placed a particular amount of feet away from each other. It is important to also note that we must provide a quiet and dim-lit atmosphere. Hand washing is another procedure I wanted to highlight during my orientation. Hand washing is also one of the most important things we can help and teach children do. Hand washing takes place at certain times of the day. This is a screenshot of the procedure. You should have also received instructions on how to obtain access to our policy and procedure manual. You should review all policies and procedures. I am only highlighting a few. We have quite the amount of procedures. It is important that you familiarize yourselves. Ask questions when needed. Hand washing is done at certain times for certain reasons. Children and staff are required to wash their hands throughout the day. Diapering. Infant and toddler staff primarily complete diapering procedures on a daily basis, multiple times a day. We provide diapers for children in our infant toddler programs. We do not provide pull-ups. We do not provide diapers for children in preschool. We do work with parents in order to transition the children once they are ready to potty train. It is important that you review the procedure for changing a diaper. Most importantly, you must always keep one hand on the child the entire time, especially on an elevated surface. Procedures for changing a diaper are required to be posted near each diaper changing station. Cleaning and disinfecting. Each classroom has a cleaning and disinfecting checklist. The process of cleaning and the process of disinfecting are different. It is important that you familiarize yourselves with the chemicals that we use, in addition to the difference between cleaning and the difference between disinfecting. Here is a screenshot of our current cleaning and disinfecting checklist. As you can see, certain tasks are required to be completed by staff immediately. Other tasks are required daily. Some tasks are required twice a week and others weekly. It is important that you review this checklist on a daily basis, that you sign off on this checklist when the task is completed. Please ensure that you have the proper tools and supplies necessary to complete these items. Always keep cleaning and disinfecting supplies away from children's access. This disinfecting checklist also addresses safety matters. Be sure to review those items. Another thing to note is classrooms should be free of clutter. In order to thoroughly clean and disinfect surfaces, they should be free of clutter so that it's more easily cleaned and disinfected. Please be sure to put away items. Rotate toys as necessary. Let's talk about meal service. Meals should be relaxed and unhurried. Sufficient time is provided throughout your daily schedule to provide an unhurried meal service for all children. Typically, Mr. Paul and Miss Mary have your food carts delivered to your classroom within the allotted time. Please be sure to follow your daily schedule and feed children as planned. Also pay attention to the developmental readiness of each child. More information will be shared with you during the CACFP training video. One thing to also highlight is that each classroom has a food allergy list posted. Familiarize yourselves with those children in your classroom that may have a food allergy, and a food substitute is required and provided. Formula preparation. It is important that you review the procedure in regards to preparing formula for an infant. It is important that if you are in the infant toddler classrooms, that you know where the refrigerator is located and that the refrigerator is functioning correctly. A daily temperature log is taken for the refrigerator. Do not use microwave to warm bottles. Each classroom in the infant toddler classrooms has a bottle warmer. Please discard any formula that has not been used within the 1 hour. Storing formula and breast milk. It is important that, again, that you review the temperature log for your refrigerator in the infant toddler classrooms. Be sure that formula containers are labeled with the child's name. Be sure that all bottles are labeled with the child's name and date that the formula or the bottle was prepared. Work with the parent to ensure that any nursing parent providing breast milk is also following the requirements by providing you the necessary information to properly label. Use your bottle warmer to warm bottles and never refreeze any thawed breast milk. First aid and CPR. Soon I will be able to ask you if you have an up-to-date first aid and CPR certification. If you do not, we do provide that on site. I will follow up with you individually to determine when training is scheduled. Each classroom has a first aid checklist. Because each classroom has a travel bag with first aid supplies. You must check your bag on a monthly basis and review what items are missing. This list is the list provided through DCFS. Any items added to your travel bag must be noted on your list. If you are in need of additional supplies for first aid, please email me the list of items needed. I will then provide you those items. All items for first aid are located in my office, room 145, inside the closet. All director have access to my closet in the case that I am not available. Medication administration. We do make a reasonable accommodation to provide medication to all children during the school day. We provide an annual medication administration training to staff during our August pre-service. We review common provided medications. We review documentation. We review the 5 rights in regards to providing medication to children. We also discuss rescue medications such as inhalers and EpiPens. Please know that we do not have a center EpiPen. Only children who have been diagnosed with a severe allergy and have been authorized by their primary care provider to have an EpiPen on site are able to receive that EpiPen. Medications are located in your travel first aid bag. Therefore, travel first aid bags must be inaccessible to all children. There is a designated spot in each classroom. Please be sure to read through the medical conditions list located in your classroom to learn about children who may have a medical condition and may require medication. Some of the medications offered at the FDC are over the counter. For example, Aquaphor. Aquaphor may be given for children who have eczema. If documentation is provided, the parents are then required to provide the Aquaphor. We then can apply the Aquaphor ourselves or have the child apply themselves, depending on what is appropriate. If you have any questions regarding our medication administration policy, please let me know. I apologize. But also by limiting pests, by limiting food inside your classroom, you also eliminate or help eliminate any pest. The playground inspection. We are privileged to have 3 playgrounds on site, literally in our backyards. The infant toddler program has playgrounds, the preschool program has a playground, and the school age program has a playground. Each playground is designed for those age groups and only those age groups. Each morning, designated staff visit the playground to inspect and ensure it is safe to use. If anything is noted, the playground may be closed for a period of time. Governor State University has a facilities department that may address any work-related orders that need to be addressed. It is important that you know playgrounds cannot be accessed if the designated staff has yet to inspect it. Playgrounds are also off limits on Wednesdays during the summer and springtime when the lawn is getting addressed. If you notice anything concerning, please contact the director on duty so that we can address any concerns related to the playground. At the end of each day, staff are required to put away all toys. We have sheds available. Do not leave any toys sitting outside. Due to the weather, they can wear and tear. It is the responsibility of the closing staff to put away the toys. Incident reports. This is very important. Children will get hurt, unfortunately, in any early childhood education program. Although we work hard to provide active supervision, to set up the environment, to have items that are appropriate for the age, children might get hurt. If a child gets hurt while at the center, you must document. We have an in-house incident report. We also then transfer the information to a DCFS incident report where the parent is given a copy. Please keep in mind that parents must receive a copy of the DCFS report. That report must be typed. The director on duty must review prior to providing it to the parent. If any incident takes place where the child's head or face are involved, you must contact the parent as soon as possible to provide notice. Do not wait for pickup time. Oftentimes, your judgment must be used in order to justify the need to document an incident report. If a child falls and gets right back up, does not cry, no TLC tender loving care is provided, no first aid is required, then perhaps you may not need to complete an incident report. Again, be sure to review the Creating a Culture of Safety training video and review the incident report procedure thoroughly. Fire drills and tornado drills. As part of our emergency preparedness, we must conduct fire drills and tornado drills. Fire drills are conducted on a monthly basis. Tornado drills are conducted throughout the months of March and October. The process is to contact the facilities department. The engineers set off the alarms. Our DPS, Department of Public Safety, walks over and does a walkthrough to provide the all clear. Typically, fire drills and tornado drills are not announced, but as the Health Services Director, or in my place, the Director on duty, will be the one to facilitate both fire drills or tornado drills. We are then documenting the information. Please ensure that you review the evacuation map posted in each classroom. You must know where the nearest exit is in the case there was an emergency. All of you should receive the Risk Management Manual. Within the Risk Management Manual are procedures responding to emergencies. Please review. We have had a plethora of situations occur, from the fire alarm going off to a tornado warning, loss of water pressure, a scare with a potential bomb on campus, as well as loss of water heat. In our Early Head Start program, we also have a prenatal program. We provide home-based services to our prenatal participants who are eligible for Early Head Start. Within that program, we have a curriculum that we follow. We provide resources and transportation when needed. We also have incentives to provide our prenatal participants. We guarantee a center base or home base slot for the baby when the baby is born. If you know anyone within the community, please refer them to our Early Head Start Family Support Specialist. Here is my contact info. I reviewed the items on the orientation checklist, but again, health services relates to so much more, and I urge you to please review the policies and procedures. Ask questions when you're shadowing the teachers in the classrooms these next few days. Contact me with any questions you may have. Here is my email as well as my office phone number.